Tooth pain is often dismissed or treated too late, but many patients don't realize there is a dental specialist uniquely qualified to diagnose and treat most common causes of tooth pain, infection, and inflammation. That expert is an endodontist. Endodontists are dentists with 2 or 3 additional years of advanced specialty training focused on the inside of the tooth, its nerves, roots, and surrounding tissues. Joining me to tell us more is Dr. Katz, the president of the American Association of Endodontists. Thanks for joining us today.
Thank you for having me.
So what exactly is an endodontist and how are they different from a general dentist?
Well, as you said, endodontist is a dentist, but we have 2 to 3 years of additional training and education. So we focus on the inside of the tooth, the nerves, the roots, and the surrounding structures. Typically, you would think of us as the root canal specialist, but we're actually much more than that. We're the tooth saving specialists. We help patients that are in pain. We help patients avoid unnecessary extractions, and we help patients to avoid treatments that could be expensive that they don't really need.
And when should someone see an endodontist?
Well, you want to see an endodontist if you have pain or swelling, sensitivity to hot or cold, if you've broken a tooth, or if you have had trauma to your teeth. If you're not sure, ask your dentist for a referral to an endodontist. But let's be very clear. There's no amount of pain or swelling that is normal in your mouth. So you can also find endodontist.com and you can referral from your dentist.
Now that is really good to know. You hit on this earlier. They are known as the root canal specialists, and so that's been a really hot topic nowadays. So are root canals really that painful, or is that a myth nowadays?
You know, that is really one of the biggest myths in dentistry. Root canals are not at all painful. Root canal procedures are very much like having a routine filling done at your dentist. We have new techniques, new technologies, improved anesthetics that make the procedure comfortable, quick, and most importantly, pain-free. Our patients oftentimes say to us how easy that whole procedure was. We like to say, this is not your grandmother's root canal.
Well, I love the sound of that because so many people are so scared of getting those. But why is saving your natural tooth better than extracting it?
Well, there's nothing that really looks, functions, or feels like natural teeth. They are so important for your ability to speak, to chew, and that all-important smile. But it's really much, much more than that. We now know that if you maintain healthy teeth, that you can improve cardiovascular function, reduce the risk for diabetes, improve cognitive ability as we mature. So in short, by taking care of your teeth is not just about comfort or aesthetics or cosmetics. It's really an investment in your long-term health and well-being.
Yeah, so many people are on health and wellness journeys, and starting with, oral care is certainly so important. So if people are interested in learning more, maybe they've been living with pain for days, weeks, maybe even years, where can they go to learn more?
Well, please don't live with pain. Don't be afraid to go to your endodontist. Go to findmyendodontist.com. There's all kinds of information about saving teeth, or you could find an endodontist in your neighborhood.
All right, Dr. Katz, thank you so much for stopping by today.
Thank you for having me, Elle.
Time now to check in on today's weather with Good Morning Kentucky.